introduce my team. Let's go.
A few moments later.
An electric shock in the case of a woman with wet hands refers to the harmful effect that occurs when electric current passes through her body due to direct contact with an electric source while her skin is wet. Water is an excellent conductor of electricity, and when the hands are wet, the natural resistance of the woman's skin is significantly reduced. This allows electrical current to flow more easily and more strongly into the body. As a result, the current can interfere with the normal functions of muscle, nerves and internal organs. Depending on the intensity and direction of the exposure, the woman will experience effects ranging from muscle spasms, difficulty breathing, and burns to the skin to more severe consequences such as cardiac arrest, internal organ damage, or even death. This situation highlights the importance of ensuring dry hands before handling electrical devices, as wet skin increases the danger and severity of electrical shock.
Hi guys. Hi guys. Let's welcome. Today we have to do some tasks exercise by pair. So Nisa and Nurin go to exercise bar for 10 minutes, and Sasha and Teha go with treadmill 2.4 kilometers.
I want to tell you guys about causes of electricity shock. An electric shock happens when the human body comes into contact with an electric current. It can occur for several reasons, such as touching faulty or damaged electrical appliances where the wiring is exposed, using electrical equipment with wet hands, or in damp environments that allow current to travel more easily through the body, or accidentally coming into contact with live wires during repair or construction work. Sometimes, poorly insulated cables or broken plugs can also be the cause, while in other cases, overload circuits and short circuits may result in unexpected shocks. Even small household incidents like inserting metal objects into socket or stepping on an exposed wire can trigger an electric shock.
When a person experiences an electric shock, the body can show several signs and symptoms. One of the most noticeable signs is burns on the skin. Usually, at the points where the electricity entered and exited in the body, the person may also feel numbness as the current affects the nervous system. Muscle spasm and pain are also common, since electricity causes the muscles to contract forcefully. In most severe cases, electric shock can interfere with breathing, making it difficult for the person to get enough air. The heart may also be affected, leading to an irregular heartbeat or even cardiac arrest. Finally, if the shock is strong enough, it can cause confusion, fainting, or complete loss of consciousness. These signs and symptoms highlight why electric shock should always be treated as a serious medical emergency.
Electricity is useful, but it can also be dangerous if we are not careful. To prevent electric shock, we must follow some safety rules. First, never touch electrical appliances or switches with wet hand because water is a good conductor of electricity. Second, always check the wires and plug. If they are broken or exposed, do not use them. When working with electricity, always turn off the main switch before touching any equipment. If possible, use safety tool like rubber glove or stand on a dry mat. Finally, keep electrical item away from water and call a qualified person if there is any problem. By following this simple step, we can protect ourselves and others from electric shock. Treatment for electric shock. First, switch off the power first. Do not touch the victim until the electricity source is off. 2. Call for help, EMS or ambulance. Dial emergency service immediately. 3. Check for response and breathing. If the person is not responding, check pulse and breathing. 4. Start CPR if needed. If not breathing or pulse, start chest compression and rescue breath. 5. Treat visible burns. Cover burn area with a clean, dry cloth. Do not apply ice or ointment. 6. Keep the victim lying down and calm. If possible, elevate the legs to prevent shock. 7. The last one, wait for EMS to arrive. Do not move the victim unnecessarily, especially if you suspect spinal injury. Always remember, safety comes first. Electricity can be invisible, but the danger is real. Stay alert, act quickly, and your knowledge can save a life.